Your cat is trying to tell you something. Every single day. Quietly. And you are not listening. Cats hide their pain. This is not something they choose to do. It is built into them. In the wild, showing weakness means becoming a target. So cats learn to suffer in silence. To keep going. To act normal even when nothing is normal. But just because your cat looks fine does not mean your cat is fine. Every single day, cats all over the world are silently crying for help. And their owners, who love them deeply, have no idea. Not because they do not care, but because they do not know what to look for. Today I am going to show you 11 silent signs your cat gives you when something is wrong. These signs are easy to miss. They look small. They look normal. But they are not. Stay until the end. Because one of these signs could save your cat's life. Part 2. When your cat stops cleaning itself, hides away, and avoids the litter box. The first thing to watch is your cat's grooming habits. Cats are naturally clean animals. They spend hours every day grooming themselves. It is not just about being clean. Grooming is how cats soothe themselves. It is part of who they are. So when your cat stops grooming, something is seriously wrong. A dull coat, matted fur, greasy skin, these are not just cosmetic issues. A cat that has stopped grooming is often a cat that is too weak to do it, in too much pain to do it, or too depressed to care anymore. On the other side, if your cat is grooming one spot obsessively until the fur falls out and the skin becomes raw, that is also a cry for help. That is your cat coping with extreme stress or physical pain the only way it knows how. The next thing to watch is the litter box. Most cat owners never think of the litter box as a health tool. But it is one of the most important ones you have. If your cat is going to the bathroom outside the box, going more often than usual, straining, producing very little urine, or if you ever see blood, do not wait. For male cats especially, a urinary blockage is a life-threatening emergency. A male cat that cannot urinate at all can die within 24 to 48 hours. And these cats suffer in silence until it is too late. Check the litter box every single day. Know what is normal for your cat. When something changes, act immediately. The third thing is hiding. Yes, cats love cozy quiet spaces. But there is a clear difference between a cat that enjoys hiding and a cat that is hiding because it is sick or in pain. When a cat is unwell, its instincts tell it to disappear. To find the darkest corner and stay there. If your normally social cat has become a ghost, is not coming out for food, and flinches when touched, that cat is not being moody. That cat is protecting itself because something hurts. Part 3. When your cat refuses to eat and starts losing weight silently. The next thing to pay attention to is your cat's appetite. A cat that stops eating is not being picky. A cat that stops eating is telling you something is deeply wrong. And the danger moves fast. In as little as 48 hours of not eating, a cat's liver can begin to fail. This condition is called fatty liver disease. It develops quickly and it can be fatal. If your cat has skipped 2 meals in a row, do not wait to see what happens. Call your vet. And if your cat is suddenly eating far more than usual, that matters too. Sudden increases in appetite can be early signs of diabetes or thyroid problems. Both of these conditions are serious and get worse without treatment. The next thing is weight change. We see our cats every day, so gradual changes are easy to miss. But if your 10-pound cat loses even half a pound without a reason, that is a 5% drop in body weight. For a person, that would be like losing 7 pounds out of nowhere. You would go to the doctor immediately. Unexplained weight loss in cats can mean kidney disease, cancer, diabetes, or severe dental pain making it hard to eat. Unexplained weight gain can point to fluid buildup from heart disease or other serious conditions. Weigh your cat once a month on a kitchen scale. Write it down. If you notice a significant change with no clear reason, talk to your vet. Part 4. When your cat's voice changes and its energy disappears. The next thing is a change in your cat's voice. Your cat talks to you every day in its own way. Through meows, chirps, little sounds that you have come to recognize. So when that pattern changes dramatically, pay attention. A cat that suddenly starts yowling loudly at night, seeming confused and disoriented, may be experiencing feline dementia. This is more common in older cats than most people realize. It is frightening for the cat. They do not know where they are. They are calling out because they are lost and scared. A cat that was always vocal and suddenly goes completely quiet may be withdrawing because of illness or emotional distress. Both silence and excessive noise can be signs your cat needs help. The next thing is changes in energy or sleep. Cats sleep a lot. That is completely normal. But there's a difference between a cat that is resting and a cat that is lethargic. A lethargic cat does not play, does not explore, does not react to things that used to excite it. It sits in one place with glazed eyes and no interest in the world around it. This kind of low energy can be a sign of anemia, kidney failure, heart disease, or cancer. It should never be dismissed as the cat just having a lazy day. The next thing is the way your cat holds its body. A healthy cat is relaxed and open in the way it sits and moves. A cat in pain guards itself. It hunches its back. It tucks its legs tightly underneath its body. It keeps its head low and its eyes half closed. This position protects the abdomen from pressure. If your cat is sitting hunched and still for long periods, something inside is hurting. Do not force it to move or touch it aggressively. Get it to a vet. Part 5. When your cat's eyes change, behavior shifts, and breath smells wrong. The next thing is your cat's eyes. Healthy cat eyes are clear, bright, and equal in size. If your cat's eyes look cloudy, or if one pupil is noticeably larger than the other, that is an emergency. Unequal pupils can point to neurological disease, a brain tumor, or dangerously high blood pressure that has caused a retinal detachment. There is also a thin pinkish membrane in the inner corner of each eye called the third eyelid. In a healthy cat you never see it. If it is visible and partially covering the eye, your cat is unwell. It is one of the clearest physical signs that something is wrong inside the body. Any discharge, redness, squinting, or cloudiness in the eyes needs to be evaluated by a vet. The next thing is sudden aggression. If your gentle loving cat suddenly starts hissing, scratching, or biting when you touch a certain area, please do not punish it. That cat is not being bad. That cat is in pain. When you touched that spot, it hurt. And lashing out was the only way it could tell you to stop. Pain-induced aggression is one of the most misunderstood things in cat behavior. A personality change like this almost always has a physical cause. Take note of where exactly the cat reacts and share that with your vet. The next thing is breath, drooling, or trouble swallowing. Bad breath in cats is not normal. Breath that smells like ammonia is strongly linked to kidney disease. Breath that smells unusually sweet or fruity can be a sign of diabetic ketoacidosis, which is a life-threatening emergency. If your cat is drooling excessively, dropping food from its mouth, pawing at its face, or seems to have trouble swallowing, that points to severe dental disease, mouth ulcers, or oral tumors. These conditions are painful and they get worse over time without treatment. Smell your cat's breath occasionally. Look inside its mouth. Pale gums, inflamed tissue, or loose teeth all need professional attention. Part 6. Your cat is counting on you. Do not let it down. Your cat trusts you completely. It cannot call for help. It cannot tell you where it hurts. It cannot make an appointment or describe its symptoms. Every single day it is depending on you to notice, to pay attention.